Hello. I'd like to use this opportunity to introduce you to some of the changes that have happened while you've been away and while we've been away. During this COVID pandemic, things have changed a little bit, and we like to think for the better. So when you first come to the office, you'll notice the waiting room is a little, changed, a little simpler at the moment. When you first are contacted by the office, there'll be a phone call to run down your, the normal screening questions on COVID to make sure that everything is okay on your exposure level and your health. When you come to the office, we'll ask that you call the office and talk to either Terry or Sonny and let them know that you're here. And one of our staff will meet you at the front door and bring you in. Once you're in, we'll ask that you go over and use the hand sanitizer and clean up. If you've got any gloves on, you take those off first. You really should have a mask on. Everyone walking into the office is required to have a mask, including ourselves. Okay, so once the staff is hand sanitized and you've hand sanitized, then we'll do two screening procedures. One will be to use a temporal thermometer to check your temperature. It's becoming much more the norm, and obviously we're concerned with that. The second will be that we'll put a little finger clip on your finger, and that reads the pulse oximetry, the level of oxygen currently in your blood, which can be a leading indicator of changes in the lungs. So it can pick things up before you have symptomatology and coughing and the like. So once we've got the readings on those two items, then we will bring you back to the operatory. The staff member will walk you back to the operatory that you'll be using. They'll sit you in the chair and they'll review the screening questionnaire on an iPad, and you'll sign off on that everything is okay on your COVID screening. They'll then take it a step further to review your medical history in depth to make sure that everything is okay on that front and that nothing has changed in the months since we've last seen you. Once we're satisfied on that front and everything has been evaluated, then prior to any treatment being done, either by a hygienist or myself, we would have you do a rinse with disinfectant rinse that will basically clean up the oral cavity before we go in there. You'll actually rinse for a full 60 seconds, please, and then spit it back into the cup that you got it from. And set that aside. We'll have a tissue there so that you can wipe your lips off. So at that point, the hygienist or the doctor would be putting on the rest of their PPE, which would include a face shield over our mask and goggles and our gloves. You're used to seeing us in protective equipment. We're just taking it up that one extra step for COVID, which is appropriate both for yourself and for the staff. I will then, in the hygiene operatory, we'll be doing hand scaling and selective polishing. We'll get things nice and clean, but without stirring things up a whole lot along the way there. And from then on, it should be fairly normal to what you're used to seeing. We look forward to getting back together with you again. We've missed you for these many months, and it'll be nice to get back together and get caught up. Take care and stay safe.